السلام على رسول الله. أنا اسمي الدكتور رجب.Alzahrani, Assistant Professor Medical College at Albaha University, ومعايا زميلتي الدكتورة أروى عبيد. She's a demonstrator in ENT department in the same college, and we are going to demonstrate the very simple basic operative surgical skills intended to the short course of the 5th and 6th year in our medical college. Actually, we would like to stress on points that this is very specific to the students in our college, in our needs, and later we will have more extended and maybe wide principles. First of all, I'd like to show everybody the principles of the holding all instrument. This is mosquito, artery curved forceps. This is tooth forceps, DeBakey or non-tooth forceps, and needle holder or driver again. And this is the stitch scissors. So we have a tissue scissor and stitch scissors. The first demonstration actually it will be how to open the stitch as a nurse or surgeon, like this, and you handle it to the sterile field and to be taken by the scrub nurse. And after that, each stitch, I hope this is good to the each stitch actually there is a number, and there is some of the informations for a student. I'd like only them to know the size and is it cutting or blunt according to the tip of the needle. So it's cutting 3/0, and the type is, this is the color, it's not important, but it is monofilament. So it's a synthetic monofilament, size 3/0, and it's cutting needle. So mainly this is used for the skin. How to take it? Extract. I don't know if it's clear. Extract the needle from the apex of the needle, and one tick again. Every instrument, the needle holder or driver, it should be in the curvature of the needle, and from the 2/3 from the tip in the curvature apex of the one tick. There is 3 actually steps, and there is 3 steps in any instrument. 1, 2, 3. 3 tooth, it should be in the first one only. Okay, now we take it, and you can straighten your threads. I hope it's clear, and it should be in a very specific way. 2/3, 1/3, and 90 degree, 2/3, 1/3, 90 degree, and on the tip exactly. So this is wrong, and this is not right as a principle. Sometimes you need to do it, but as a principle you should put it 2/3, 1/3, 1 tick, and 90 degree. Straighten your needle, and then after that you start to each one of these. It's intended to be like this by the company because this is a gap, and there is no gap. This is a gap because sometimes we take the scar and there is a gap. I will demonstrate how to stitch the simple surgical straight stitch in this first episode. The handling of the instrument actually in many ways. One is to put the index as a support and your thumb in one of the rings of one of the handle of the needle holder, only the tip, and also the other fingers, the middle finger to support in the shoulder of one of arm of the needle holder, and the other one is just put it in the other ring. It's not right. This is not right, and this is not right. The right way is like this: the index to direct and support only the tip of your finger, the thumb, and the middle finger also on the shoulder of the other arm, and the fourth finger in the other ring. And the other one is to do it like this: the whole three finger holding the one arm, and the other one is by the eminence, hypothenar eminence, and the thumb above the one ring, and also again the index finger to support the both. First step, to half the wound. So wound from here to here, just put in your mind to half it. I mean, to be very straight, and like in this one, you can see in this one, you should put it in either in the keynotes, or you half it, make the half thing here and half. So this is if you don't know, but in the straight surgical wound, it's not mandatory to have your stitching. Usually what I like, according to the side of the body and the face, we are choosing half centimeter, in other it's 1 centimeter or 1.5. I like the students to remember 1 centimeter is the standard, so you can count 1 centimeter from the edge of your wound, and just you choose your place. Very important to start the steps. Very important to know that you grasp inside the wound to take with the tooth, so you will not injure the skin. Sorry, again, the pointed is in the skin that it's good and not injured, and the other one is inside. Hold it up, and it should be 90 degree, again perpendicular, 90 degree, the needle on the skin, 90 degree, and you choose the distance from the edge, and also from the edge of the wound, and also from the wound itself. So let's say half or 1 centimeter, and I'd like to stress again to the student of standard distances. Let's say 1 centimeter and 1 centimeter perpendicular. So 1 centimeter, 1 centimeter. And here, because of the wound is small, I'll choose half. So half centimeter, and the distance is half centimeter. 90 degree, take it. The depth, actually, it's, you can see the depth of the exit of your wound. See, the same distance. So again, 90 degree, the depth that you would approximate your wound, and comes from the other area, and you take it. My advice to the beginner is to take it all, to hold it by this forceps and release it, and put your wound like this, so it will not be. Till you leave just small space on this end. Then after that, again, you reload your needle holder, one tack, the same principle, away from your wound. Again, hold your skin by the pointed, the same area exactly, and the same distance exactly, and put it 90 degree, and you rotate your wrist. So 90 degree and rotate your wrist in the same distance and the same depth. It should be the same distance and the same depth. Take it off from the other edge of this of the skin. Same distance and the same. Then after that, you put your needle holder along the wound and take from your non-dominant hand 2 circles of this thread of the stitch around your needle holder and take the tip. This is not right. This is the right way, the tip, and one tick. Take it away from your dominant hand. So it will be, you take it from right side, take it to non-dominant left side. This is the first stitch, and this is surgical knot. You can see it, very nice, surgical knot. Then don't leave your needle holder the same area, and you should take it from the other side around the threads. Take it from the tip again of the threads, from your non-dominant hand to your dominant hand, and you can see how it's you reef knots. You slide it on the stitch, and then after that you take it to one edge of the wound. On one edge of the wound to become sure that it goes exactly on the previous stitch as a reef knot. The same area, the same thing, I mean. Take one round around the stitch, take it from your dominant right side to an non-dominant hand, and this is, see, complete circle of stitch will be very nice, and it will not be open. Don't leave it, it's around it, same. And I advise, according to the stitch type, the nylon not less than 5 to 6. Again, the same thing from the right side to left side. Put it in one of the wound side, and then after that, 5.5 centimeter. When you hold it like this, bring the other one to your assistant. Kusse doctor. See how she is. See, she is making curve, and yeah, perfect. You take both to your side so you can see where is the distance exactly, and just simple tick, so it will cut. Now this is the first one, and 1 centimeter, 1 centimeter, 1 centimeter until you finish your wound. cannot see the wound at all. The same distance between each, almost approximately, and this is will be the last one. Again, 90 degrees. See how I'm looking, how I'm using my hand. The same distance, 90 degrees, and then the same depth from the other side, and the same distance will go out. And this is not for the beginner, as I said. It's better to go outside and deload it, but I'll use this when you become expert. So the same distance, and go from the other side, open your needle holder and reload it again. And as we said, the same, round it one to take it from non-dominant side or hand to the other dominant side, and after that leave it the same. Take the opposite from the non-dominant to the dominant side, and this will be the reef knot, the last reef knot. Again, from right to left and from left to right. This is 4, and the last one from the right to left. Take the stitch, and this is will be the end of the first basic operative surgical cell that we would like every one of the student to know how to do it. And this is only a theoretical part, and the practical part will be a practical in the skill lab of the college. Covered. See, there is nothing, and it's together with these stitches. Simple, the same, almost the same distance, the same way, and on the right side of the wound, completely halved. And this, as I said, the first skills that we would like you to know it. Simple, interrupted surgical suture with the instrument and type of the instrument. Thank you so much, and see you in next skills.